Okay. This is left side. This is right side. Okay. Gingival problem. Mobility, bone loss. 141516. This is mirror view.
Okay.
And you can see the 8. If we are planning for terrier, it is better to remove 8. But we didn't tell 8. Anyway, we are going to put implant till 6 only. Now we will see the X-ray. Patient name, no?
Subramanian.
So this is a 4, 5, 6. What is this variation?
It's apparently it is
2 roots, no? Something.
3 roots are there.
3 roots.
3 roots. Maybe 3 roots.
No, it is 2 only. Sir.
It's 3 only. How will it?
Apparently maybe another root.
Apparently there will be
You
another.
count.
2 roots irundha buccal and ingual da.
That is 1, 4, no? 1, 4 or 1, 4?
Buccal
We will see this. Okay. So this is the panoramic view. Now we will do the planning only with the IUP or panoramic view. Starting with the 6 palatal root, we can use it. Distal to 6 also we can use it. Some short implant we can place. Mesial root, palatal side there is bone. We don't know the third dimension, but tentatively we are planning. 4 and 5, 1 implant we can place, but here the sinus is here. So beyond the socket definitely we can go. Or slight mesial tilt we can go. The canine tip is buccal only. So palatally you can tilt and go little bit 10 degree, 15 degree, like how yesterday case went. Tilted. Here the sinus is close. So either 5.5 something like that. That is a better option. Here palatal socket. So here we can, after extraction, if there is good buccal bone, rub some decent buccal bone, we can put a compressive. If not basal. 5.5. Here also 5.5. Here one small compressive. This is a tentative plan with panoramic view.
When do we select, there are chances of changes of the implant surgically now.
Yes.
Yeah, I mean,
Yes.
that is tentatively.
Even if you plan with simplicity, some mild changes will happen. So now we will start with distal to 7. So distal to 7. Sinus floor, crustal bone, thin, very cancellous bone. You can place a wider diameter, shorter compressive, maybe 8 or 10. Just we are looking for some possibilities. 8 mm implant will be okay. If you go closer to this is one more small trick. If you go closer to the palatal side, this length will increase. Here the length is smaller, but if you go like this here, the length you can place a longer implant. Something simple like this, no? You can go even 10 something. Now we are checking the palatal root. Okay, palatal root. Palatal bone is present and thick. Yesterday we saw very thin bone. So this is very ideal for 5.5. Luckily, this interdental furcation bone is also present. Even buccal bone is also only till here it is missing.
If we are giving 1 or 3 teeth, we can use 5.5, no problem.
Yes,
Only
yes.
for single
Single
tooth.
tooth. You cannot put one single implant here and put one molar. So 5.5, 10 or 12, whatever it
So
is.
here either one buccal root or palatal is mandatory.
No, this is palatal. This is palatal.
That's what, palatal one we have to use it, and the other one either buccal, distobuccal or mesiobuccal, any one root we have to use.
Not distobuccal, only mesiobuccal.
Mesiobuccal.
Distobuccal never.
Never.
Because distobuccal is too close to the buccal side. Even the mesiobuccal, we are not placing implant in the mesiobuccal. Up towards the palatal side. Okay.
So for lower molar, you said 2 implants. For upper,
For lower molar?
lower molar, you said single tooth 2 implants. For upper also single tooth.
2 implants.
The same what applies?
Same. Okay, now we are looking in the mesiobuccal root area. this is the mesiobuccal root area, you can place a short implant here. The bone quality is good, it's not cancerous. Smaller diameter, 3.75 into 8 you can place. These are various options we are just checking. Now we are coming to second premolar. Second premolar usually it will have two roots, no? Sorry, one root. But here it has got two roots. Maybe a 5.5 we can place. The sinus floor is close to the apex. If the sinus floor is here, then it is an easy case. But here the sinus floor is touching the apex. Only a 5.5 we can place. But this bone is good, so it can hold the 5.5. So in our plan, two 5.5 comes, right? Palatal socket one 5.5. Second premolar one 5.5. And this is the. Oh yes, that means the premolar has got three roots, right? Buccally two roots, and it will come.
Yes, sir.
Oops.
Only when two roots are present, one will be buccal and one will be palatal. So
Okay.
when we see buccally two roots, definitely there will be one
Third
palatal.
root. Okay. So the challenge here will be make sure you are not breaking this small root tip. If it breaks, then it is tough to remove. It's very thin. The bone is cortical here, so do the extraction slowly. So along the palatal socket we can go. It's a very straightforward, simple scenario. Compressive implant is ideal, right? Even 4.2 you can use, 4.2, 16 you can use. Okay, so finally our final plan is three implants, one implant along the palatal socket, 4.2 something, here 5.5, here 5.5. If we want to add some more stability, you can place a short compressive here. But the more distally I place implant, the more risk I get from this 8. So if I remove this 8, then it is better. Otherwise it is better to stop with 3 implants. Actually we told delay loading for this patient.
Oh, that's fine.
But actually you can load immediately also, because this implant is good. This implant is good. Only this implant it may be utilized.
So even in delayed loading, there will be the abutment head will be
It will be projecting outside.
even
No problem.
no problem.
Only thing you have to educate the patient, don't probe.
In that cases, do we give any splint anything?
No, nothing. Just do enough abutment preparation. So
So
they will be eating that.
abutment level should be below the contact to illame ನಮ್ಮ crown போட்டு
Yes.
I mean to say like
The abutment will be here. Right?
yeah, we place an implant in the same
Yes.
incision part அதே லெவல்ல விட்டுறோம்னா
We will do welding here.
வெல்ட் பண்ணி
And there will be 2 mm clearance now here for process abutment preparation. Same way. There is nothing different from immediate loading and delay loading.
So
Only
usually-
conventional
It is submerged.
submerged or you are putting only healing up and down.
So welding இல்லைனா என்ன பண்ணலாம்?
If there is no welding, what you can do, you can take impression and send it to lab. They will make a metal frame. Metal frame. Fix the metal frame and leave it.
Okay.
Or over the metal frame, if you want to do immediate loading, over the metal frame you can do the
immediate.
But if we are leaving, we should put a metal bar and then leave.
yes. Second day or third day also you can fix the metal frame.
You can just leave the metal bar and later on after like healing we can go with I mean
No need to remove the metal bar. Over the metal bar you can give the
No,
permanent also.
I'm saying that only leave the metal bar and later on you can place
Yes.
the final process.
Yes. We will start this patient.